Hi, so good morning to everyone from wherever you're joining, and for the others, good evening, good afternoon from wherever you are. Nice to have you all. And before we literally dive deep into a conversation with Ritesh, it would be nice to see more faces instead of the alphabets. I'm grateful that all of you are able to join in, but faces would make the discussion more personal. And this is something Flynn also keeps telling our people. It sets you up for what's lined up in the future. More conversations with the admissions committees, with networking with other members. It'll be great. So, and let me also outline once Ritesh goes ahead with the conversation and we address a few questions that we've already received. Thank you, Dr. Lakpa. Thank you, Dr. Saketa, Nancy, Deepthi, Doctor. Nice to meet you all, see your faces. Thank you. And sorry, like I was saying, we have a few questions that we've already received from our community. We can discuss those. And if you have additional questions, I'm sure we would be glad Ritesh himself is here. It's a great opportunity for you to shoot those questions to him in person and get it straight from the horse's mouth, someone who's been there, done it. So feel free, we'll throw the conversation open in a few more minutes. Right now, let's get started. Ritesh, I don't want to go on and on about um, general introductions, and without much ado, I'm handing it over to you, Dr. Ritesh Chawla. See you, Alan. Over to you.
All right. Thank you. Hi, everyone. Very nice to see you all. My name is Ritesh. A brief intro about me. I started this journey back in 2022 and 2021, actually. Yeah. For CU, it was 2021. And while I was applying, I applied to all the schools that was possible. But CU and Washington were the only ones I could apply with my final degree. I didn't have my degree at the time when I was applying for most of the schools. I got and started the program in 2023. Those 2 years were actually the best years of my life. I would still go back there and live it again. Long story short, I graduated in December of 2024. And since then, I have been working with a DSO for the past 8 to 9 months now. And do let me know whatever questions you have. Don't think twice about asking them. No questions are stupid. Um, Ask as much as you want. I know how difficult this journey is and how confusing it can get. So I would just like to help as much as I can.
Amazing. Ritesh, can you also walk us through your profile building exercises between the 21 to 23 time frame?
When I first applied to CU and Washington, CU requires their own SOP, so I'm very glad about that because the first SOP that I wrote was just very, very lame. So I worked super hard on getting my SOP in point. Usually, the first mistake that I did was just rewrite my CV in a paragraph form, which is something um, I think most people make that mistake to begin with. When I corrected that part and added more personal touch to it rather than just having to just dictate my own experiences, that helped. That I think helped a lot because the second time I applied with my CV and the SOPs, I got in 6 to 7 invites, I think, if I'm not wrong. It's been too far back, so I don't remember the exact number. Um, I For the second round, I interviewed with Temple. I interviewed with UCSF, um,
LLE.
LLU, Indiana, and there was one more which I forgot again. But yeah, so those were the ones. But make sure you work to make it as personalized as possible. Just don't let it be redundant because you get two. It's like two chances. You can put your professional stuff in the CV itself, the bare minimum that they ask for, and use the SOP to make sure that is much more personalized because they want to know you as well. Everyone has vast experiences, but not everyone is a personalized human. They don't want robots anymore. who can just go into an office, drill a tooth, and just call it a day. That is something that we as international dentists lack a lot, the communication and the personalized part. So make sure you reflect that you are capable of doing that in your SOP.
This is a very important aspect that you have touched upon. And we also want to talk a little more about it. I think we'll come back to it. Maybe in 5 more minutes, we may have some more people. So we'll come back to it in 10-15 minutes. In the meanwhile, can you walk us through the amount of shadowing or dental assisting experience, if any, that you got in the US, your volunteering, these kind of activities?
Yes, so I'll just narrate the entire experience I had. In India, I graduated in 2021, worked for maybe 10 months in India before moving to the US. I started my shadowing experience as much as I could while I was in the first year of my undergrad in India. So I only have shadowing experience in the US. I have shadowed general dentists, oral surgeons, periodontists. Um, so that is my shadowing experience. I did not have any dental assisting experience. Volunteering wise, I just used to go to a food bank NGO kind of place. Um, that was the only thing I could do under my visa restrictions. And yeah, I have to be very honest, I did not have much experience before getting in.
Um, so this actually debunks a couple of myths or a couple of off-repeated questions that we get. Is assisting important? Question A. Question B. You were a fairly fresh grad, right? Considering that you graduated in 21 and had about 10 months of clinical experience back home and only shadowing in the US, right? So it kind of debunks the myth or a fear that a lot of applicants have. Is someone like me who's a fairly fresh grad stand a chance? What do you
I
think?
think I think everyone would stand a chance. The only thing I would emphasize on, let's say you graduated in 2020 and you did not get in 21 or 22. While you're applying in 22 or 23, the only thing that they want to see is, have you been working hard during that time? That is the only thing that matters. Have you been constantly building your profile? And like, what have you been actually doing to reach here? That is the only thing that matters. If you're going to keep applying with the same experience, you're not going to change your shadowing places, you're not going to change your DA or assisting, how do you call it, assisting experiences. You just keep doing the same thing. They're just going to think that you're not serious enough for that. For example, my profile personally, when I look back at it now, I think it involved a lot of different things. I had research experience in my first year and in my third year. And then I did not leave any opportunity where I could just go and present something. I used to do a lot of paper presentations, poster presentations. No matter I actually did not win any prizes or any awards during that. I just used to do it. So trying and to be able to try to do new things, that what they want to see. They don't want you to be perfect. Nobody can be perfect in all domains of life. If you're doing something and you're just doing with as much as you can, that's the only thing that matters. Don't just sit idle and hope for it to happen. It's not going to happen. To be bluntly honest with you, it will never happen. No matter how many years you sit, it is just not going to fall in your lap. It is an exceptionally difficult journey, and you are competing with people from all around the world. It's not just people from India, it's not just people from US, Canada, or all those areas, but you're actually competing with people from all around the world. And not everyone will have the same drive as you have. So just put that drive forward. Let them know that you are willing to do new things, and you will never stop. That's the only thing they want to see.
That's a very noteworthy point. I just want to pause for a second and ask if anybody is in their second cycle, CAPID or even CU. Is any one of the applicants here in their second cycle now? You can raise your hand. Dr. Sailaja has raised. Okay. So a summary from Dr. Ritesh's conversation is it would be amazing to show an improvement or additional experiences from last application to now. That would show a trajectory of growth, learning, coachability, eagerness, initiative. These are all, I think, additional brownie points over and above your shadowing and clinical and volunteering experiences. On that note, Dr. Ritesh, what do you think Colorado specifically looks for in its applicants?
I think CU is a very, very different school. They don't want people to know everything. The only thing that they expect from you is that you will be humble. You will be open to, leaving all that you have learned back there and start afresh. Because like how when I started my journey, I did not know as much because I did not have any experience. I had people who had 10, 12 years of experience, but they also started from fresh. So as long as you are open to being coachable, you are open to learning what they want to teach you, and just believe that they're actually there to help you rather than being a rebel, being a revolt. That's not going to work. People are here to help you, and that's what they want. They want their alumni to be at standards with a US dentist. No matter how much you have learned back home, it's all going to start afresh. And as long as you're willing to give it a chance, they will be perfect with you. With Colorado, your education is in your hands. I mean, there will be certain criteria that has to be met, but you can always go over and above that. You just meet that criteria first, and no matter what you want to do, nobody's going to stop you.
On that note, Dr. Ritesh, how varied was your cohort? Colorado has around 35 to 40 seats every year. So, what sort of
Uh,
cohort do you have?
I was in one end of the cohort with bare minimum experience. I have a really, really close friend of mine who was on the other side of the cohort who had 13 years of oral surgery experience in India, like full-fledged oral surgery. And imagine if he was someone who is cutting for 13 years is asked to now do a class 1 or class 2 prep. Imagine the hell he had to go through. So he went through it. As I said earlier, he was open to starting afresh, learning more things, and he graduated with flying colors. In between those two, we had people who were specialists, endodontists, oral surgeons, perios, and people who have been practicing general dentistry for 5, 6 years. We had people who were on visas, people who were not on visas, on other statuses. So it was a really, really diverse environment. We had a lot of Indians in our batch, but that usually changes every year. It's not like Colorado only wants Indians or anything of that sort. Um, as long as you are a credible applicant, it doesn't really matter what your nationality is.
Amazing. So, there is diversity in terms of nationality, in terms of experience, in terms of educational background. I mean, endodontists, oral surgeons, fresh grads. But having spent 2 whole years with them, do you think there was some connect the dots or a common thread or a common trait that all of you exhibited? One thing that probably Colorado loves.
I think that would be the way we rewrote our SOPs.
Okay.
So when we all started meeting each other, the one thing that we discussed is how we changed our SOPs. Like the oral surgeon friend I was talking about, his SOP was barely half a page, but he put it so well that even in half page to 1 page length, he was able to tell his entire life. And that's what matters. Nobody wants to see 3,200 words where it's all redundant. You start with one paragraph, you repeat it 5 times, and you end it at the sixth time. They are the people who have been doing this for past 10 years. ISP program started in 2005, I think. So 20 years now. They have been doing this for 20 years, and it's very easy for them to just make out whether you have been repeating the same thing again and again and again, or I mean, they just want you to stand out. You will have 700 people standing in front of you, and it will be very easy for them to just make sure these 40 are the ones that stand out. Simple as that. So making a personal touch on our SOPs was one common thing that I noticed.
Personal touch. And at the beginning of this conversation, itself, you did tell us that the first time your SOP was more of a recitation of your CV, whereas the second one was more humanized, was more about experiences. Um,
Exactly.
would you like to briefly tell us about, or will it be a repetition for you, about how to approach an SOP? We have a head coach as well who will supplement it later, but from your mouth, it'll add more weightage, I believe.
I think just start going back to the first day you started this journey. Like for me, my dentistry journey started when I was, I think, 6 years old. That's when I knew that this is what I wanted to do. Not even just saying it for the sake of saying it, but that is the time I knew what I wanted to do. So I started over there. um, that's where my SOP started. Then I went into my school journey. Then I went into my college journey, how it was. And during those three stages, I also briefly put a speck of how my life was. Like I moved a lot all across India. So I just put a few lines about that. Then something about how my college journey was. And in that big paragraph of 5 years, I was in the US also for some time. So I just mix and mash that part so that it doesn't feel very boring. Basically, it has to feel like when you're reading it, a story gets created in your mind, a vivid experience gets created in your mind. If I'm reading an SOP and I can actually imagine what the person was doing, and then it ends at where you are right now, it's like a perfectly blended story. As long as the other person is able to imagine it, that's what it was. That's what it requires.
Got it. Key word from there, as long as the other person can visualize your story from your statements. On that note, I'll also ask our head coach, Sushmita. She's here. She's been writing statements, few statements for the last few cycles. I would like her to add her inputs to this as well.
Thanks, MS. Okay, so before we get started with how to approach the CUPS, let's try and understand also how the CUPS is different from a CAPID PS. Now, everyone knows that a CAPID PS is 5,200 characters, a CUPS is 3,500 characters, right? But when you approach a CUPS, a lot of times you can also approach it like a supplemental answer. The reason I say this is because with a supplemental answer, you would give some amount of personal context as well as target it to that particular school, which is exactly what you do with a CUPS. A lot of things that people do in terms of going wrong, like Ritesh mentioned earlier, is that you make it an unofficial rendition of your CV. It looks like your CV has been copy pasted there, or on the other hand, you make it too personal. The key here is finding that sweet spot in the middle, doing justice to your journey, having that humane aspect to what made you want to be a dentist, and then orienting that towards CV.
Even before writing a personal statement, it's not a one stop approach. It takes a couple of iterations. Quite a few people have written 10, 12 iterations. It's important to jot down your experiences, your takeaways from them. And like Ritesh said, as long as it's not a rendition of, I've been assisting or shadowing at multiple places. No, that's not what they want to know. What they want to know is, what have you learned from shadowing experience? I've learned patient communication in the US. I understand how care is customized, how we deal with anxious patients. This is what I learned from this experience, this shadowing experience. That is how you show and tell. That is what has to come through from your personal statement to make you memorable. Okay. And see your personal statement, like the coach said, it's not just about picking things about CU that you like or everybody talks about. For instance, the Guatemala Smiles program that Ritesh was saying is not applicable to an ISP candidate at all. So looking for information, you probably, like he did, talk to 10, 12 people, alum, faculty, people who know in and out, who will have insight. That's a great kind of primary research you can do. Or one other thing that you could even do is follow these school social media platforms, look into their calendar of events. There are a lot of activities that keep happening, but at the end of it all, like with said, pick what aligns with you. Do not try and tweak your story to fit in with you because they'll be able to see through. They've been doing this for 24, 30 years now, so they know what sounds genuine, right? On that note, while you have your personal statement queries addressed and you have an idea, I also want to ask Ritesh about his interview experience because that's another opportunity that you get to showcase your true self to the admissions committee. And in Colorado's case, interview precedes bench. Ritesh, how was your interview experience? I know it was years ago, but I hope you remember.
It was actually, when I compare all my interviews together, Colorado was the one interview that I was least tensed in. Like they made me feel super comfortable,
Hmm.
and like they were not barging me with the clinical questions. Like I interviewed for one of the schools, and the first question they asked me was about an RPD. So I immediately emailed them back that I'll not be continuing with the bench test because I don't want to be in a place where there is no personal touch to education. Colorado per se was three people interviewing me, and one was a faculty member at that time, one was ex alum but still a faculty member, and one was a current student. I don't think current students are sitting on the panel anymore. But they made me feel super comfortable. They wanted to know me as a person. Obviously, they did have questions about my CV, about the things that I did. So we answered those questions. But other than that, they wanted to get into why I do photography, why I do what I do, and it was, to be honest, very, very, very calm interview, and I didn't feel any pressure or anything. They just wanted to know me. That's it.
Hmm. This reminds me, I think photography was a very central part of both your CAPID PS as well, I think, with sprinkles of, uh, wordplay as well. I don't know, I'm just remembering from 3, 4 years ago. So that's also how you build your statement and your interview. Pull in, pull in information from your personal life, uh, probably include your hobbies. See if it can be said, drop hints. For instance, someone as good as Ritesh is with photography or a passion for it can also come across as someone with an eye for detail, creativity, and ability to think out of the box. These are all things that even a dentist can find handy. And as a cohort member as well, you add a lot of variety, right? So that's how you make yourself interesting and you stand out in the minds of the interviewer. But Ritesh, I know this is about CU, but you also interviewed at 3, 4 other places, and you tell us that CU was the least stressful of all the 4, 5. Overall, what sort of candidates are they looking for, or intention of the interview? Generally, clinical, or about the person?
I would say it's more about the person, and because if you are someone who is open to being trained clinically, as long as you're a good person, you are an open person, they can take care of the clinical aspect. That's why you're going to school. But if you're someone who is clinically super strong, but not the best person to be studying with 40 different human beings, it's not going to work out for either of you. I mean, you will end up getting a degree out of it, but it will not be something you will understand the importance of. Neither will your faculty be able to, in future write any recommendations for you, because it will not be the perfect match. So as long as you are a much more personalized, great, and open to teaching human beings, the clinical part they can take care of. That's why we have so many exams, so many boards, so many licensing stuff and all those things, so that you come out as a clinically apt human. But if you're someone who is just close to learning, or who's just gonna say no to every opportunity they give you, it's not gonna work out.
This is actually a very oft repeated statement we've heard from successful applicants in the past. Um, Before I add other things. If anybody has questions, please feel free to raise your hands. We have Ritesh with us for the next 45 odd minutes. You can approach, you can shoot your questions at him directly in the meanwhile. Okay. Okay. So they want to know you as a person. And Dr. Ritesh is emphasizing on the fact that A, being open minded, B, being coachable, C, being a good human being, which I think becomes pretty obvious when you go for your interview. Therefore, what you write in your statement, who you are as a person, and how you express yourself in your interview, all these three dots should be connected. They should align with each other. This is also a takeaway for all of us. Uh, in the meanwhile, again, I'm repeating, feel free to raise your hands and ask your questions. If you're not in a position to ask your questions, you can type them in the chat box as well. Ritesh, that's about the interview. Um, Bench. We've often heard that CU's bench is top notch. You must have attended other benches as well, Temple, for instance, LLU. How was your bench experience here and overall?
When I appeared for it, my bench was a virtual one, so it was much more stressful than in person, believe it or not. The in-person bench is a super stressful environment. The only thing I would like to add in there is be transparent. When we take the bench, we like, how do I put it? There are faculty members in the hall who have more experience than all the candidates combined. So they can see through if you are trying to cheat, or if you are trying to, you know, do something that is not allowed, or you're trying to use something that is not allowed. Like, when we take bench, we trust the applicants that they are gonna just follow the guidelines and the rules. So don't try to be over smart over there. Just go in there, do what you're supposed to do, and walk out. Other thing is, practice as much as you can, because the people who are checking your preps, trust me, I know those people, and they don't even need a perio probe to tell that your prep is not up to the mark. Their eyes have a perio probe. Um, and Just follow the regular guidelines. I think CU gives you the guidelines a few weeks before your bench. Follow those regular guidelines, practice as much as you can, and your prep doesn't have to be Stevenson level, or be super polished, or be magnificent, as long as it is clinically acceptable. And if it was a human, you can actually restore it. That's what matters. Don't try to mess up your preps in searching for excellence. The only thing you want is clinical acceptability. That's it.
Amazing. I think Dr. Samiha's question is also on these lines. Did you do any bench prep courses before your? No, you didn't. So it
No.
was just home prep, and did you get it evaluated or critiqued by someone?
Yes, I used to send my preps to, like, I didn't know my bench was gonna be virtual, so I started practicing long ago. So I used to send my preps to people I knew here, people who were at that time in CU, and who had graduated from CU. I used to just send them photos, and they used to evaluate it. That's it. But I just followed the regular guidelines through normal books.
Okay. Uh, I'm going to pick on that one word, two words that you said. A long time ago. You started preparing a long time ago. And that reminds me, CU's bench historically is in June. At least in the last 2, 3 years, it's been in June. So now I think even if they start prepping now, it would be a good prep time. Even if people do not have the means or the resources to go for an organized bench prep course. For instance, Dr. Ritesh is admitting that he did not go to any bench prep course, but he did his home bench prep. But the key point or the key takeaway is to get it critiqued from the right mentors.
Yeah, that's what matters. As long as you know your mistakes and know how to correct them, you're gonna get there.
Amazing. Clinically acceptable is all that we need to
Yeah,
focus
because
on.
when you're dealing with an actual patient, you're not gonna spend 4 hours making your preps look magnificent.
Correct.
Like
Makes
it
sense.
has to be clinically acceptable. It has to meet the standards, but there is no standard that says the composite should be super polished that you're actually able to see your face in it.
Okay.
Nobody asks for that, right? So don't aim for things that are not asked for.
Dr. Samiha, you've raised your hand. Would you like to unmute and ask your question?
Hi, Dr. Ritesh. I have a question for you. So, you've mentioned a couple of times that you got in touch with alums and candidates and see you in other universities as well. So, I wanted to ask you: is there like a professional or a way where you've approached them, a specific way you've talked to them? It's not like you can just go up to them and ask them questions. But is there I just wanted to ask, like, is there a good way to ask them so you can get information from them?
I used to randomly find people on Instagram, on LinkedIn, and send like a hi hello message as to why I'm reaching to them.
Mm-hmm.
But obviously, it cannot be, hi, tell me this. I have actually gotten emails and Instagram messages where someone had said, hi, can you, no, I mean, it was so blunt, I
Yeah.
didn't even feel like replying.
Yes. Yeah.
Like, it was basic
I've seen
humanity.
that with many people, but that's the reason I wanted to ask is like, is how is your way of approaching people? Because I feel that networking is very important during these days, and getting to know everybody, getting to know about the actual school is really important because it needs to align with your values too. So,
I mean, I just used to say hi, introduce myself, why I'm reaching out to them, and if they have the time to respond to me, rather than like I have received emails where it says, "Hi, can you read my SOP?" I'm like, no, that is not how you reach someone. That lacks absolute basic decency, humanity, and all the concepts of personalization.
yes.
Nobody's gonna reply back to you, even if it was AI won't reply back to such emails.
Yeah.
Um, but just make sure you're respectful of the time of the other person also.
Mhm.
They're not obligated to help you, right? It's not in their job description to help you, or they're not obligated to help you. You are the one benefiting from them helping you, right?
Yes.
Just be respectful of that part. As long as there's mutual respect between two people, I think no one would hesitate twice to help you.
Okay. So LinkedIn and Instagram, such kind of social media platforms help you a lot.
Yeah, yeah,
Okay. Thank you so much.
you're welcome.
And I think CU also has these regular seminars where Dr. Kritika Bhaskaran herself comes, answers questions, that, and it also has school tours, right, where you also get to meet existing students. So if that's a possibility for you, for any interested applicant, it'll probably throw up opportunities.
Yes, I mean they do virtual tours, they do in-person tours, but people take them super lightly. Like
Correct.
they just consider it as a vacation or something, which it is not. It is really important how you present yourself. I know many people fail to understand that the importance of that, and they still think that it's just a degree and it's just a school, but it's not home country anymore. US is a lot about how you actually treat a human. Even when you succeed, when you all, I know you all are going to get there. When all of you graduate and actually get into practices, one thing that you will notice is that patients very, very quickly pick up on how you are behaving with them. And if that is something that they're not comfortable with and they don't feel comfortable sharing with you, they're not going to come back, and they're not going to share the entire, like in the US particularly, a dental exam is less of a dental exam and it's more of a psych eval, like to actually understand where the person is coming from and why this particular condition happened. You have to understand the background behind it, and you cannot understand it if you yourself don't understand the importance of personalization, being able to put yourself forward, and be like a basic skill to be actually able to talk and listen. Most people just want to talk, talk, talk and expect being listened to, but on the other hand, they don't want to listen to anyone else, and it's not going to work out again. And not even for CU, for any school that for that regard.
This is actually a very interesting point that Ritesh has brought up. We've heard during one of these kind of webinars that we've done in the past, one of our applicants telling us about USC. USC has a, if you guys are aware, have already applied, you may be aware that they have a PBL kind of learning curriculum, and therefore their interview and PBL, shortlisting session also has a PBL, problem based learning session, where a problem is presented and a group of 7, 8 people discuss and arrive at a possible treatment plan. The natural tendency for all of us is to contribute, right? Especially in a where you're being observed. Our natural tendency is to contribute to the conversation, take the lead. And I remember one of the applicants, the successful applicant, telling us that her contribution was minimal. All that she did was sit patiently, hear everybody's opinion, and venture an opinion, or more of a mediation is what she did. And she still got it. So, like Ritesh said, listening and touching the right chord, touching the right nerve with the other person is a very important skill, both in interviews and in these kind of networking events. Networking, like again Ritesh said, is something a lot of us overlook, or probably the way we have come, it's taught to us differently. But here, networking, putting your best foot forward, at the same time, staying clear of borderline stalking, these are all things that we have to learn and proactively engage in. Ritesh, I have one more question for you. When
Mhm.
you were in school, did you also get an opportunity to be part of screening or engaging with prospective applicants, students in your position as student?
Not officially, like not from the school side. I just used to get emails about if I can help them, and
Hmm.
if someone was being respectful rather than instead of asking me, and if they're ordering me to help them, they're never gonna get a reply from me. Um, but there
Fair
were
enough.
like very, very nice people who were actually stuck and were actually looking for help, and I helped 2 or 3 people, and all 3 of them got in.
That's great.
Yeah.
Is there any way that do you have a social media handle or something where people can approach you for queries or respectful comments, opinions?
I mean, I have Instagram, but I usually reply to emails I get when I can. When I was
Okay.
in school, I had much more time. As of now, there is no time left in life. So I still try to reply as soon as I can, but it usually takes me like 3 or 4 weeks to even read the email.
Fair enough. If you're comfortable sharing it at the end of the session, maybe you can just let us know. On that
I'll
note,
put it right now before I forget.
thank you. Yeah.
Mhm.
You were talking about having limited time. What is your day looking like? Where are you currently? What sort of opportunities open up after a DDS?
It again depends on, first thing it depends on is your status in the country. Keeping that boring part aside, it's very exciting. I am right now in North Carolina. What my day looks like is my workplace is like 50 minutes from where I live. So it's like 2 hours of commute per day. So I have to at least leave by 6:45 in the morning. And usually my day ends around 5:30. And then I come back around 7 o'clock, and then I just relax. If there's time, I go to the gym, but usually there is no time or energy left. Clinic schedule wise, I do most of the surgical procedures. I am not much of a restorative guy. So, I mean, there are fillings, there are regular general industry people, things to do, but I am more into surgical stuff, implants, full mouth extractions, alveos, dentures, and all those kinds of things. But again, you can take the direction you want to. There are practices that are more restorative focused, if that is something you are, or you can get into a residency, which I had no motivation to get into because I was so done with school. And yeah, it's a really exciting phase after you are done, and even when you are doing it, it's very fun.
Even when you're doing it's fun despite the stress. Okay,
Yeah, I
amazing.
mean, it feels good once you are there. It actually took me 1 year to actually realize that I'm here. For one entire year, I was in disbelief that how did this happen.
And with an equally inspiring cohort, it gets doubly exciting, right? They are as motivated, if not more. You have to buck up to them as well.
Yeah, I mean, everyone was full of energy, and I completely understand how traumatic this journey is. I mean, it is super difficult, and kudos to all of you for still doing this. Trust me, not everyone has the guts to do this. People will maybe try once and give up, but someone who is able to do this again and again and again, not until the point you're actually in there, that is what matters. And it actually speaks volumes about you as applicants, where you are still willing to do it. And that I think that is what matters. As long as you're willing to do it, you will get there. I'm 100% sure all of you are going to get there.
In essence, Dr. Ritesh is saying it's not about if, it's about when you will get in, right? Yeah.
Yeah, I mean,
Dr.
everyone has a certain time that they're going to get in. I mean, it's going to happen, but you just don't know when it's going to happen. So the only thing we can do is just keep trying.
Amazing. Um, Dr. Sailaja, would you like to go first and ask your question to?
Yes. Uh, Hello, Dr. Ritesh. This is Shailaja. First of all, thank you for your time and for doing this all for us. And my question is, CU has this specific question. What, in order to be successful in this program, what personal characteristics and skills do you think you need to improve? I think, if I'm not wrong, how do you take on this? How you want us to approach on that? Let's say, for example, if I'm someone who tries to compare myself with others' work, or I don't want to take them as a negative person, but I just want to improve that on certain skills, certain areas I want to improve. So how do I present myself on that particular question?
So with the, as you put that, you try to compare yourself with others and how to put it in a positive way.
Yeah.
If it was me, I would just put it like the fact that this makes you open to feedback, right? If you're comparing yourself to others, they're gonna give you feedback. You're gonna give self-criticism, and that only makes you better, rather than putting comparison in a negative way where you're just comparing and demotivating yourself and belittling yourself. If you are able to take positive out of it, take more criticism, improve on it is what matters. As long as you're able to do that, you should be you should be able to be transparent about this trait of yours and still have a positive outlook, because at the end of the day, if you are improving by comparing yourself to others rather than getting demotivated, um, it's going to work in your favor.
And also, can we put some dental related skills? Let's say if I want to improve my diagnostic skills, can I put that skill, like, if I want to improve, or
So
just
that
the personal skills?
that is something that will not differentiate you, because think of it this way. It's like how do I put it? It's like you are going into a conservative dentistry class with an aim of learning what they're already going to teach. Make sense?
Yeah.
So it's already going to happen. Like, they're going to improve on your diagnostic skills. You are going to learn more about diagnosis. So
Mhm.
why not use those words, use that space for something that, gives them more information about you,
Yeah.
rather than telling them something that you want to do, which is
Mhm.
already going to happen. Makes sense?
Mhm.
It's going to help you. It's just going to waste space for you,
Mhm.
because diagnosis is still going to happen in any of the schools that you go. They're still going to train you.
Yeah.
um, it's good that you want to learn more about it, but think of putting it in a way where it gives them a perspective about you
Mhm.
and still conveys what you want to do.
Okay.
Yeah,
Yeah. Thank you so much.
you're welcome.
Thank you, Dr. Sailaja. Dr. Samiha, that's an interesting question. I think you should ask that to Dr. Ritesh directly.
So my question again is, how has CU prepped you for the outside world dentistry apart from the clinical aspect?
CU taught me a lot about patient communication. Um, no matter, like, even though right now here I'm doing it, I like talking to so many people at once. I can vouch for the fact that I was a super introverted person when I first started. I would just not talk to anyone. I was very closed, introverted person, which was not working in my favor. My patients were not really happy with me. My classmates were not really happy with me. My faculty was not really happy with me. So, how CU transformed me into someone who is actually able to talk and be a little more extroverted is what it did to me, because now I am able to sit with a person and actually extract that emotional reasoning as to why something happened to them. That is one thing that CU did to me. Then, apart from clinical, what else? Yeah, I think apart from clinical dentistry, the only thing that matters is personalization and to be able to talk. We put a lot of emphasis into actually dealing with the person first and then consider them as a patient. So that is one thing that it taught me a lot.
Do they give you like a how would I say, like a trailer of a movie, how dentistry would be, when you join in a new clinic after you are a fresh graduate, and do they like give you a trailer about it, how things would be, or like, just a small thing? I know it's a little stupid question to ask, but
So the thing is, nobody can tell you what's going to happen when you graduate, because every state is different. Trust me, every practice is different. There will be practices who are more rural patient based, more geriatric patient based, but nobody can train you for exactly what's going to happen. They can just they can give you like gist of things that can happen, and
right.
some of those will happen, some of those will not happen. The most you're going to learn is when you
Hmm.
start experiencing it, you're going to mold yourself to fit much better in that environment, and at the same time you will be happy about it.
Can I ask one last question? I know maybe there is other people in line. Would there be one quality or any one thing that you would, you know, tell the aspirants here that it would prepare them for the world outside, or like for everything?
One thing I would say is, don't think that you are a know-it-all. No matter how much experience you have in life or industry, you never know it all. So if someone out there who has more clinical experience than you, more life experience than you, and is trying to teach you something, Don't think that they're trying to belittle you or they're trying to stop your growth. They're only trying to help you and reach at a point where they are. Make sense?
Yes.
The first thing that fresh grads do when they come out of school is think that they are someone who knows everything about dentistry. They can handle all the complications. They have seen all of it, which is not even 1% true. When complications start to happen, fresh grads are the first people who walk out of the operatory. I am saying all this from personal experience.
Hmm.
Um, just be open to being trained,
Right.
because whatever you learn at school was applicable in the school environment. Like, for example, in the outside world, when you're in private practice, no one is going to give you 2 hours to do a crown prep and then call the patient again for a scan, make nice, beautiful temporaries. No one is going to give you that time. You
Right.
barely get 15 minutes to do a crown prep and a scan.
Yes.
And then, be it your restorations, always make sure you check your own work. Never be overconfident. As long as you are the best critique for your own work, nobody can question you. Just keep learning, or just always keep learning. There's no end to learning.
Thank you so much for patiently answering all the questions.
Worries.
I like the fact that throughout this 45-minute, 1 hour discussion we've had, at various points and through different choices of words, the one common thought that has resurfaced is an openness to learn and that humility and not know it all attitude. And it pretty much reflects whether it's in your statement or when you go there for your interview or even for a webinar or a meet. I think it pretty much comes through whether you're willing to learn, open to feedback. I think that's been Ritesh's constant mantra. Right? Dr. Nancy, you have a question for Dr. Ritesh?
Yeah, I just hello, thanks for your time again, Dr. Ritesh. I know it's difficult to take time out of a busy schedule, but thanks for doing this for us.
No worries.
I wanted to ask one simple question that what kind of exercises are common in like CU bench tests and other bench tests as well? Like is it like class two preps, crown preps, and like what particular exercises are they do you often see in the bench test?
To be very honest with you, I am not allowed to say that.
Oh, okay.
Yeah. The only thing I can say is those are general dentistry procedures.
Okay.
Nobody's going to ask you to do a third molar impaction.
Mhm.
It's just going to be all general dentistry following guidelines from like standard books like Studevans, Rosenstiel, all those specific books. Just follow those guidelines for regular day-to-day dentistry procedures. It's not going to be anything um, super specific. Like, I don't think there's any school that asks you to do a onlay prep or anything of that sort.
Yeah, that's what I
Yeah,
meant.
it's all going to be just general dentistry procedures following regular guidelines.
Okay, perfect. Yeah.
Um,
Thank you.
Ritesh,
Yeah, well,
thank you, Dr. Nancy. Sorry, you had already asked us that question in the chat box. I think
No
it's good,
worries.
you finally asked Dr. Ritesh himself. Ritesh, this might be, I don't know, maybe out of your purview or something that nobody has exact info about. But do you know how um, the new H-1B visa rule will they impact the employment opportunities for foreign dentists? Have you heard rumors or murmurs about how it's getting easy or getting difficult for students
I would
graduating?
say at this point it is pretty stressful. Um, I personally don't want to get into all that. Um, the only thing that I know is, sorry.
No, Caapid itself is pretty stressful. To add on to that, let's not get into it right now. Okay, that's what you say.
Yeah, the only honest opinion I would say is always have a plan B ready. Um, things can go south anytime here at this point. As far as H1B goes, I have heard that F1 to H1 change of status will not have the $100,000 fee, but I'm not sure how correct it is. So don't quote me on any of these advices. I'm not sure how correct they are. Uh, I think the only people getting harmed by this rule are the ones that are first time H1B without any prior status in the US. Um, Other than that, non-cap exempt FQHCs are probably not um, not gonna get hit by the 100K fee, is what I have heard. But it all depends on your employer if they're even willing to start the H1 process to begin with. Not all of them do.
But that's something at least the stocks will have to worry about 2, 3 years down the line, 2.5 years down the line. So hopefully things should look up.
The good part about US DDS is Canada
Mm.
accepts it. And once you are done with the Canadian exam, you can practice in a few more countries except for Canada and the US. I think Australia, New Zealand, Ireland, all those countries also accept the Canadian exam. But in no way, shape, or form that Canadian exam is easy. So make sure you prepare twice as hard as you are doing right now, because it is three or four times harder than CAPID was.
Yeah, I think that's a discussion and that's a headache for some time later, hopefully. At least for now, CAPID
Yep.
itself is quite stressful. So, do you remember
Yeah.
a rough timeline by when you applied to CU? Was it early? Was it late? Was it okay? Does it matter?
I don't think it matters to begin with, but I think the cycle, when I applied, the cycle opened in September, mid-September something. I finished my application and sent it off, I think around start of November. My the cycle was gonna end in February of the following year. So February 2022 was when the cycle ended. I applied in November 2021, got my interview invite on 3rd of March 2022, and my interview was 24th April 2022. Then I got the bench invite on 15th June, and I got my acceptance on the 7th July.
I did the entire timeline here. And November
It's
is
in great.
neither too late. Yeah. And good memory, huh? November is not too late, not too early either. For most of you listening in and wondering, it's been a month since you opened. Am I late? Am I early? October is not late. November is not late. What matters more is quality of application. Okay. In fact, one of Sushmita's favorite things to say is, Sushmita Sirat, about one of our applicants who applied. Would you like to repeat that, Sush? You're on mute.
Your voice got a bit jumbled. What did you want me to say in this?
Quality, timely application. And for people wondering if it's already late, if November is late, if December is late, is there a timeline that we know when people have applied, it has worked for them? You would like to say that? Your
No, I think
favorite?
you take it, MS.
Okay. So we have had applicants. I remember this. Last year we had a couple of applicants who applied on the very last day. I'm not saying please meet at the last day. But what I'm saying is all that matters is good quality application. Especially for you because you have to do everything all over again. Once you upload your CAPID application, you still have to upload 3 letters, get your recommenders to upload them again in a portal. It's a separate PS. And it's important that you get all these in order and also give yourself cushion because CU's process from start to finish takes about 3 weeks, anywhere from 7 days to 3 weeks. So while you're not late, While even Jan Feb is not late, what is quite important is to get it in without delay, without compromising on quality. These are two important attributes we also remember. A, quality application, not a hurried one. B, how to get it done without procrastinating. Because CU's process end to end take anywhere between 7 to 3 weeks, 7 days to 3 weeks. I think that's largely from our side. Are there any more questions that you would like us to answer? We have Ritesh here for another 10 to 15 minutes. I think he's already touched upon both aspects. If you have anything, feel free to type in, feel free to unmute. And I think Ritesh has also liberally shared his email ID with us. And he's promised us to respond as and when he gets to it. Though it may not be prompt, he will still quite likely get an answer. So,
Yeah,
okay.
you guys can ask any questions that you have. Don't think twice about it. I know not everyone has asked questions, not everyone wants to, but I'm sure many people have questions. So feel free to unmute yourself or type in the chat. You don't even have to turn on your camera or anything if you're not comfortable.
Yeah. But I think you also touched upon both aspects. That's one reason probably questions are a little lesser. Uh, any parting advice, Dr. Ritesh, from someone who's been there through the journey, got multiple invites?
I would say just be yourself, believe in yourself. I know it's difficult. It's very difficult to be very honest with you. But as long as you're focused on what you want to achieve, you will achieve it. I know you might be thinking right now that he's just saying it for the sake of saying it, but you will get there. I'm 100% sure about it. It might not happen now, but it will happen. Just make sure you keep pushing for it and just be yourself. Don't try to be over smart, and don't try to challenge or cheat the system. It's in place for a reason. Respect their system, and they're gonna respect you. If you try to, you know, challenge, belittle, or do anything that is not expected of you, it's gonna bite you back. Be very, very respectful to the whenever you get into the school, whichever school you get into. One advice I would give is be very, very respectful of the people who are teaching you. They are at that state and at that position for a reason. And as long as you give respect to them, they're gonna be your friends. But they can also be someone who can destroy it for you. So they have that power which you don't have. So always be respectful of the time and the efforts of the other people. And as long as you're more humane and you are an actual good human being who is willing to do it, you will all get there.
Yeah, I think he summed it up. Basically, an openness to learn, a degree of humility. I think those, and of course being authentic and then being a true self. I think these are Ritesh's watchwords for us. Thank you, Ritesh. Thanks for taking time out coming here and doing this for us. And
Yep, no worries.
thanks for
Thank you for having.
Mhm. I think
our
I have a
pleasure.
question.
Yes, Dr.
Doctor,
Yeah, actually, I'm a recently graduated from Nepal, and since the application process is running right now, is it a good idea for me to wait for next cycle or apply this November?
Sorry. The only part I got was that you are a recent grad and the application cycle has already started. Do you have all your documents with you? Your degree, your transcripts, your letters?
Yes, I do. Uh-huh.
I would say apply for it.
Mm-hmm. Gotcha. And also, do you have any suggestion for bettering our profile?
Just keep doing something or the other.
Mm-hmm. Gotcha.
Make sure you show it to them that you are still working towards it. As long as they understand that you are always dedicated towards improving your profile, they're
Mhm.
gonna understand that you will get there.
Gotcha.
It will make you sound like someone who is willing to try, unless you're willing to try more, unless you reach the state of perfection. It's gonna work in your favor. I would say, as long as for now, as long as you have all your documents and you feel confident that your SOP and everything is up to the mark, um, if not superseding the mark, apply for it. Don't hesitate that chances decrease in the second attempt or anything of that sort. Just go
Mhm.
for it.
Gotcha. So yeah, actually, like I got my INBD test done, and but like for in case of SOP and for CV, I think I need to refine it more, and yeah.
Yeah, as long as you feel confident about it, I wouldn't recommend submitting a half-hearted application. You
Mm-hmm.
have to make sure that you have put all that you have into it. As long as you have that, apply for it.
Gotcha.
But if at any point you feel that you're underprepared, then don't waste your money or your attempt.
Gotcha.
Yeah.
And my last question is like in case of the volunteering experience or something like that, do we need to mention in like just mention the name that I did that, or should I need to elaborate about that?
I would say, more than mentioning the name, you have to mention what you got out of it.
Mm-hmm.
Like, think it this way, anyone can go ahead and mention that I volunteered for, let's say, an NGO dental organization. Anyone
Mm-hmm.
can go ahead and say that, but what you learned out of it is what matters.
Mm-hmm.
And yeah, I mean, as long as you're able to put it into words, actually, what you actually learned from there, it
Mm-hmm.
should be all good.
Gotcha. Yeah. Thank you.
You're
Thank you
welcome.
for your time.
No worries. Take care.
I think that kind of the entire session. Dr. Arpita, I've shared the blog link here. You share the TOEFL specific blog link as well. You can take a look. It will have answers to most of your questions as well. Okay. And before we sign off, if anybody is interested in trying to test the tool that we showed you, the brainstorming interface that we showed you, you can very well email us. I'll share the email ID as well. So you can let us know. You can try this. It can help you by writing your statement or your supplemental answers for next cycle as well. It'll help you. So let us know if you're interested. It'll be great for us as well to have that feedback. Again, once again, thank you, Dr. Ritesh.
You're
Thank
Thank
you
you.
welcome.
for us with us answering people's questions. I'm sure they're inspired as well
I hope so.
because successful stories and motivational stories are what keep them going in addition to the hard work they put in. And Dr. Ritesh has also shared his email. You also know our email ID where you can contact us for more questions. Thank you, all of you, for sparing time, tuning in, and listening to us. Thank you.
All right. Good
Thank you
luck,
so
everyone.
much.
Take care.
Thank you, Dr. Ritesh.
Thank
Thank
Have a
you.
good
you.
day.
You too.
See you all.
Miss, would you like to take a screenshot?
I take it.
Thank you everyone for joining. Thank you, Dr. Ritesh.
You're welcome. All righty. Take care, everyone. Good luck.
Good luck to you, to Ritesh. Have a good day and a restful week.
Thank you.
Thank you.
It's just
Amazing,
us.
amazing job, you guys. Sushmita, MS.
Okay, stop recording.
Oh,
And
sorry.
stopping there.